Guys, Bing and Jelly tests are also very, very important. They are also asked, and they test a very particular thing. They test for ossicular stiffness. Very particularly, they are testing for ossicular stiffness. So we have three ossicles. We have the malleus, we have the incus, and we have the stapes. Okay, so we have the malleus, we have the incus, and we have the stapes. Correct? ये अजीब सा स्टेपस बन गया है, ऐसा होता है. All right. Now, sometimes in otosclerosis, there will be the footplate of stapes will be fixed. So what happens is, if there are any pressure changes, if we make any pressure changes in the middle ear, and if there is otosclerosis, then the pressure changes will not translate into the cochlea. This is basically two ways that we are testing through Bings and Gillet. Okay, so Bing में क्या करते हैं? We are placing. So this is the ear. This is the mastoid bone. Okay, so we are keeping a struck tuning fork here on the mastoid. All right, but what we are doing is with a finger, and the way I remember it is Binger. Bing sounds like fing, so Binger, finger, you can remember it. So we take the finger and we, while placing the tuning fork on the mastoid, we press open, press open, press open, press open. We are creating pressure fluctuation. In that pressure fluctuation, ideally, because of masking, no masking, the patient should hear the sound from the mastoid to be fluctuating if the pressure changes are translating properly, which is in a normal case scenario. Normal case scenario also, if you take your finger and you say, you will hear your sound go, you are hearing your own vibratory sound fluctuate when you are opening and closing your ear. That is normal. That means whatever pressure changes you are creating over here, those pressure changes are also translating to the inner ear. But if there is ossicular stiffness, if there is otosclerosis, for some reason the pressure changes are not translating, then even though you are doing like this with the finger, the patient is saying there is no fluctuation in sound. The patient is hearing only but not a that is the thing. So that is what Bing's test is. It is testing for ossicular stiffness, especially for otosclerosis. So there's a lot of assessment you can do in great detail just by tuning forks, and that's why conceptually it's very fascinating. Gilles is the same thing, but instead of finger, you use a sigil speculum. Sigil speculum is just like that BP cuff, and it has a port that goes into the speculum. So you know this ear speculum that we use? Whose ear speculum mein there is one pipe that goes, and there is something that you can press like a BP cuff. Right? So instead of creating fluctuations with the finger, you place the speculum and then you press the small, this thing, the sigil. All right. And that will also create pressure changes. Your tuning fork is still on the mastoid. Both are doing the same thing. Only thing that is different is that Bings you use finger and sigils you use Gilles. And luckily for us, the Gilles sounds like sigils ka sigille. Okay, so that's how I remember it. Many times you can remember things with concept, but अगर किसी ने अपना नाम चिपका दिया है, it's very hard to remember conceptually. So I try to find tricks and clues, and generally see with Bing and Fing, I always never have a confusion. Bing's test is always using the finger, and the Gilles test is using the Sigillis speculum, and that's how I remember that. But the main thing conceptually that you have to understand is we are looking for ossicular stiffness test. All right. So each tuning fork has its purpose. So when you're using Weber's, you're trying to lateralize and find out the pathological ear. Whereas in René's, you're trying to find out the type of pathology, whether it is conductive hearing loss or not. By using René's and Weber's, you can tell whether it is sensorineural hearing loss or not. Absolute bone conduction is purely to look at cochlear function, whereas Schwabach's test is to look at whether there is a conductive hearing loss in that particular ear. Like that, Bings and Gilles will tell whether there is ossicular stiffness and whether pressure fluctuations are going from the middle ear to the inner ear or not, which should happen in normal cases. But if there's ossicular stiffness, it will not happen, and that means there is something wrong in the middle ear. All right.